My name's Atheeshan and I'm a third year medical student at Russell's Hall. The main things I heard about Russell's Hall was, considering how long it takes to get here from Selly Oak, that they give very good teaching sessions with all the Ed Fellows. At the end of second year, we had our hospital prep course, which it seemed kind of pointless at the time because it's nearly the end of holidays. Like, why do we need this? But it was oddly helpful in that it gave you, as soon as you go in, you kind of know what you need to do. As in, like, it's kind of drilled into your head. You need to go talk to patients all the time. You need to, you know, get a good rapport with your F1s and your consultants, and you need to kind of get into the mood that I always feel there's like a transition in learning. So when you were in GCSE, they always said it's different when you go to A-level. When you get to A-level, it's different when you go to uni. And I feel there's that gap in medicine as well. After you finish your first 2 years, there's definitely a difference in learning style when you get to clinical medicine. Considering the amount of time that I spend in hospital, I like to keep my education and hospital work strictly in the hospital. So I'll stay here as long as I need to make sure I get all my work done. As soon as it's done and I go home, I like to keep my private and social life rather separate to my medicine, so that's kind of how I keep the balance and my sanity. I was genuinely quite excited, even though it is quite a nerve-wracking experience for most people, purely because it allowed me to experience medicine as I wanted to see it rather than reading books all the time. I was able to see doctors practice medicines, manage to sit in surgeries and be involved in surgeries, so it was truly an honourable cause. I really enjoyed it.
I think the main thing that I kind of found was that I kind of put consultants up on this pedestal because, you know, they are so far up the ladder and whatnot, so you don't really feel like you're able to approach them. But from like the firm leads and the consultants that I have, I think the best thing I've known is like how easy it is to communicate with them, and just they're willing to go out of their way to help you in a way, because that's why they wanted to become teaching consultants in the first place. So yeah, I think that's what I've learned the most. Time management is definitely the most important thing to do when you're in placement. It just keeps you, it makes sure you're not faffing around and everything's done precisely on time. And at the end of the day, it's going to be rewarding to you in that you've got time free when you go home rather than panicking over stuff that you need to do for the next day. So I think my main kind of issue was talking to, not really patients, but the healthcare professionals, because obviously they're also qualified, and it's daunting to be around them and ask, hey, have you got anyone who's available that I can take a history of? But I've never really encountered a problem being here. Everyone's been all like gone out of their way and been like, okay, yeah, why don't you check out this patient, and really giving you really good cases to write up and stuff. So yeah, it's been good. You get your own kind of base. You have like 4 consultants or 3 consultants, and you get like a base ward, but it's kind of loosely fashioned so that you can, if you want to, you can just venture anywhere around the hospital, because every department and clinic knows that it's a teaching hospital, so they expect you to come along. So there's no kind of, oh, you can't come into this. It's more like, yeah, come in, let's go through this together. So it's really good. If you compare it to like other universities and stuff, they tend not to be able to do the clinical skills that we do until they get to 5th year, but we're already cannulating, well, supposed to be quite good at it by now, considering our clinical skill passports are in. But yeah, so really getting hands-on and doing, you know, procedures on patients. Obviously, there's all the office staff, which are like my first line of defence. You know, I love going to them for all the help and support I need. But also, the consultants, your allocated consultants really do pay a lot of mind to you. So say after your teaching session, they'll be like, oh, how have your other teaching sessions been? Is there anything you want to cover? Is there anything like you want changed or anything? So they really do keep a keen eye on you. So it's nice to be watched over.